Well, as Americans prepare to return to work and school after the holidays, doctors are warning there is no end in sight for surging flu cases. A new variant is driving rising post-holiday cases across the country and sending tens of thousands of people to the hospital, hitting young children especially hard. The dramatic spike now worse than last year in multiple states, with at least 7.5 million people infected so far. So let's bring in Dr. Bayo Winchell. Dr. Bayo, I was going to say Merry Christmas, Happy New Year. I can't keep track of the number of holidays. And it seems like we can't keep track of the level of flu cases, right? Just to start, can you explain why the flu is so bad right now?
Yes, there are a couple of reasons, but the top three things are a lot of people skipped their flu vaccine this year. And historically, we've seen a decline in vaccination rates. Plus, this strain of the flu this year is hitting hard and spreading quickly. Plus, holiday travel with people spending more time indoors, all of that is a combination, unfortunately, for flu cases to be on the rise.
And doctor, talk about how people can protect themselves, particularly in this post-holiday world when everyone is going back to work and going back to school.
It can be hard, but there are three things that I'm telling my patients to do. The first one is wash your hands more often than you think you need to. So, of course, before you eat, especially if you're using your phone is one of those items that are often touched numerous times and it can carry a lot of germs. The other thing that you want to do is wipe down your workspace. A lot of people are touching copiers, they're touching your keyboard. They may even, want to just share a personal item that they brought home that they got as a gift. So, anything you can do to wipe down those surfaces is a great way to reduce your risk of getting sick when you're back in the workspace.
Great tips. And I also saw on there, get vaccinated, right? I think there's still a lot of misinformation about when to get the vaccine, if you should. For people who are considering it, it's not too late, right?
It is not. We've seen year after year that the peak season of the flu vaccine has been even in April and May. So, this is a fantastic time to get vaccinated. It takes about 2 weeks to go into effect. But the important piece to know is if you get the flu and you've been vaccinated, you are less likely to have really severe symptoms like we're seeing, especially with this strain.
And Dr. Bayo, I understand a lot of this is fueled by a new strain, right? What should we understand about that? I believe subclade K.
Yes, yes. So influenza A is really the case that we're seeing. I'm seeing it in my urgent care, and the symptoms are really severe. Yes, you'll see a high fever, but you're also going to see symptoms last even up to 5 to 7 days. And a big thing to look at is vomiting. We're seeing a lot of kiddos, especially vomiting with the flu. So this strain is spreading fast, and that flu vaccine can be a great way to prevent getting it, but also just knowing the signs and symptoms. So if you're not feeling well, please go in and see your doctor. That way, not only can you help yourself get better, but hopefully not spread it to your loved ones at home or when you're going back to work.
Yeah, we all want a healthy new year. Dr. Bayo Winchell, thanks so much.